Hi, this is Anu, and you're watching Anu for Nurses. This video is exclusively for the nurses preparing for NORCET AIIMS, a quick review into Obg Nursing, the important points that will help you to recall what you have studied from Obg Nursing. Corpus luteum. After the release of ovum, the Graafian follicle, that's known as the corpus luteum, what's the significance of this in pregnancy is this is the one that is providing the hormone progesterone till the development of placenta. So placental development is up to 10 to 12 weeks. So till then, the progesterone is produced by the corpus luteum. Syncytial trophoblast, this is the one that's producing HCG. Pregnancy hormone is mainly known as progesterone. Implantation, date of or the day of implantation. If you are saying it from the day of fertilization, it is almost 6 to 7 days of fertilization. And if you are telling it from the last menstrual period, it comes around 20 to 21st day. So that's easy, like 14th day is the ovulation, so 6 to 7 days after is around 20 to 21 days after from the LMP. And where is the implantation mainly? Mostly it is at the posterior upper pole of the uterus. Lifespan of ova and sperm, it's around 24 hours for ova, and sperm it is 48 to 72 hours. FSH, LH. What is the significance of this? These are two main hormones in menstrual cycle, and the Graafian follicle maturation is done by the FSH, and LH is responsible for the release of ova. These are very frequently asking question. Naegele's rule, 9 months plus 7 days. Always remember, it's never first 7 days then the 9 month. Then you will go wrong in case of 28 days, 30, 31 day months and all. So it's always 9 months plus 7 days. Or we tell it 280 days. Or you can say like 10 lunar months. So that's the period of pregnancy or the 40 weeks of gestation. Non-rachitic pelvis is platyploid pelvis, and the least favorable one is also platyploid. Most common type in India, like we can say it's a gynecoid, is considered to be the most common or the most favorable type with the round brim. Fallopian tube length is around 7 to 12 centimeter, and it has got many parts, and the largest portion is mainly ampulla. The significance is this is the part where fertilization takes place. The question comes like the most common site of ectopic pregnancy is also ampulla. Isthmus. What is the significance of this part of fallopian tube? Postpartum sterilization or the tubectomy is done at isthmus, because in case of recanalization your ampulla would be required and tying the largest part is difficult. Isthmus is just before ampulla. And actually before isthmus, in some books it says it's like from the isthmus it's starting. No, just before that one more small portion is there. It's an intramural or interstitium. Then the TB fallopian tube. This is the most common cause of infertility in India. Remember, TB fallopian tube is the most common cause of infertility among women in India. And salpingectomy is removal of fallopian tube, usually done in case of ruptured ectopic pregnancy and all. Saucer-shaped depression below umbilicus. This is typically seen in the presentation called occipito-posterior position. So usually we say like it's occipito-anterior is the most common one, and there is another version called occipito-posterior in case of head presentation or cephalic presentation. So this occipito-posterior posterior position can cause a saucer-shaped depression below the umbilicus. Chadwick or Jacquemus sign. When you remember about the pregnancy sign, you know about presumptive, probable and positive sign. In the probable sign, the different changes in the vagina is the main thing what you will study in, and this is the order you should be remembering, alphabetic order, CGHO. See, the Chadwick or Jacquemin sign is the violet color discoloration. What you have studied, you know. Remember, if Goodell sign is the softening of the cervix, Hegas is the compressibility and softening of the lower uterine segment. So it starts from the cervix, then the lower uterine segment. So it's a C, G, H, and then the Osiander sign that usually happens on the 8th week of gestation. That's the increased pulsation in the posterior fornices of vagina. And remember again, Chadwick sign or Jacquemin starts at 4th week, Goodell on 5th, and then Hagar 6th, Osiander 8th. This is the order. Mittelschmerz, you must have heard about ovulation pain, and this is the term using for that. Metrorrhagia is bleeding in between periods. If it is severe bleeding during menstruation, call it menorrhagia, and metrorrhagia is bleeding in between periods. Funis is another name of your umbilical cord. Remember, the length is considered to be 46 to 55 centimeter. Once in for the JIPMER examination, there was this question about the length of Funis and umbilical cord, and the options were like 45, 55 and all, and 45 was not the right answer because some book says 45 onwards, 45 and below is considering to be short cord. So remember, if you have the options 50 or 55, you should be giving first priority for that. Ligamentum teres is the rudimentary form of your umbilical vein. After the birth of the baby or the fetus, once it's coming out of the womb, this fetal circulation structure will be changing, right? And umbilical vein is no more there, and it changes to ligamentum teres. It's the round ligament of your liver. There are 2 umbilical arteries and 1 umbilical vein. Ductus arteriosus is the one that is connecting your pulmonary artery and aorta, 2 major vessels. And ductus venosus is the one connecting your inferior vena cava and the umbilical vein. Fossa ovalis is the rudimentary form of your foramen ovale. That's the connection between the 2 atria. If it remains open, you call it atrial septal defect. It closes immediately after delivery, and later on it's known as the fossa ovalis. Ductus arteriosus related question frequently comes. That's mainly the structural and the functional closure of it. Structural or the anatomical closure completes within 2 to 3 weeks. First is the functional closure that usually starts within 15 hours, and maximum time period is 2 days. Remember that. That's very important. Common birth injury. Remember, brachial plexus injury, the shoulder dystocia is the most common birth injury that happens to the newborn. And in this 2-3 things you should be remembering. One is the level of brachial plexus injury. That's a C5 C6 injury leading to Erb's palsy, and that's very, very important. That C5 C6 level that's leading to the Erb's palsy, and the Vater's tip is the feature of this Erb's palsy. We call it Vater's tip or Potter's tip and all. And the common fracture of the newborn is that mainly happening to the clavicle. Don't write it's the green stick fracture. It's commonly seen in children. During the delivery, the most common site that's been injured is the clavicle. And brecma, this is the largest fontanelle, and it's diamond in shape, closes by 1.5 year. And you have also an important fontanelle is the posterior fontanelle, triangular in shape, closes by 1.5 months. Milia is the white small spots, with the nose and around the mouth in the newborn. Then Mongolian spot is the bluish or greenish color discoloration that's seen on the back and the buttocks. And Harlequin sign is one side of the newborn will be darker in color than the other side will be looking pale comparatively, and this mainly due to the shunting of the blood or in case of sepsis, and this is known as Harlequin sign. Decidua, the layers of uterus are endometrium, myometrium and perimetrium. The endometrial layer, that is getting ready for the pregnancy. That's a pregnancy bed, and that is known as decidua. So endometrium in pregnancy is known as decidua. Vernix caseosa is a cheesy white substance that's seen all over the body of the baby, and you can see a gelatinous substance over the umbilical cord known as Wharton's jelly. Brown fat is an adipose tissue. This is the one that's helping the baby from developing hypothermia, and it's usually seen most of the places, but mainly over the back, along the sides of the spine and towards the shoulder blade. Silent killer of newborn is hypothermia mainly, and the bronze baby syndrome is the complication of phototherapy. Grey baby syndrome is due to the usage of the drug called chloramphenicol. It's an antibiotic. Battledore insertion. You can see usually the umbilical cord attaches to the center of the placenta, and in battledore it's like umbilical cord getting attached to the margin of the placenta. Velamentous insertion means umbilical cord attaching to the membranes, as you know, amnion chorion layer is there, instead of placenta. The problem is when there is a traction, there can be chance for that dislodgement. I mean, it gets tear off from the placenta, and there will be fetal blood loss, and we might lose the baby. So that's the highest risk that's seen, or the most dangerous risk associated with the velamentous insertion. Circumvallate placenta means the placental layer, that's the amnion and chorion, that's the cover that gets double bind. So it look like a gray, thick, opaque ring around the placenta. So this is known as circumvallate placenta. Danger is once it's double bind, some portion of the placenta will be exposed. So some blood loss through that area is possible. It would just look like a placental after the placental delivery, how the maternal surface of the placenta looking like. Placenta acreta. Any abnormally adult placenta is known as placenta acreta. Normal non-pregnant uterine weight is 60 gram, and during pregnancy it changes to 1 kg. And the capacity of a non-pregnant uterus is 3 to 4 ml, or it's less than 5 ml. And the significant comes when you are doing the patency of the fallopian tube test and all. And the Rubin's test is the one you are doing to check the patency of the fallopian tube. Layers of the uterus we already mentioned: endometrium, myometrium, and perimetrium. Doderlin bacillus, a very important bacillus that's we know everywhere we have got the normal flora. Doderlin bacillus is the one that's providing vaginal acidic pH and preventing from infections. And your pH of the vagina is 4.5 to 5.5, that's acidic. And the amniotic fluid pH is 7 to 7.5. It is alkaline in nature, and this easily helps you to find out when there is a amniotic fluid leakage. You just have to find out whether it's acidic or alkaline. That's a nitrogen strip test what you are doing. Wheel chop. One important acronym what you will have to be remembering from this. That's a wheel chop. That the V stands for the variable deceleration, mainly in cord compression, and E for early deceleration. You can see in case of head compression, which are completely okay, and acceleration of the heart rate of the baby is what you are expecting. That's okay. And L for the late deceleration that you will see in placental insufficiency. Very, very important. In case of variable deceleration, the reason is cord prolapse or cord presentation. What you'll have to do is the knee chest position or the Trendelenburg position, what you'll have to give, and start oxygen, then start the IV line. And you will be continuously monitoring the fetal heart rate, and then only you will be calling the obstetrician. And E is for the early deceleration. That's usually due to the head compression, which is considered to be normal. And acceleration is what we are expecting, or what is like an expected change. That is okay. And L is the most dangerous one, late deceleration of fetal heart rate. And this is seen in placental insufficiency. Immediately turn the mother to the left lateral position, start oxygen, start IV line, and mostly she has to be taken for an operative delivery. And these are, you are finding this when you are assessing the fetal heart rate pattern, right? Your NST and all. So knee, chest or Trendelenburg position you are using in case of cord prolapse or the cord presentation. Stallworthy sign you will see in placenta previa. When the baby's head comes and compresses, the placenta heart rate will comes down. Again, when it rebound, it becomes normal. This is known as Stallworthy sign. Cuvillae uterus is a complication of concealed hemorrhage in abductio placenta. When there is concealed hemorrhage, the hematoma will be forming inside and it will increase in size slowly, cutting off the blood supply to that part of uterus, leading to purplish discoloration of the uterus. If you find out it very, very late, what happens is the patient must have to undergo hysterectomy sometimes because a lot of cell destruction would be already happened. So this is known as cuvillar uterus. Matthew Duncan method versus Schultze method. The placental separation, two types are there, marginal and central. And the marginal separation is known as Matthew Duncan and Schultze is the central separation of placenta. O'Sullivan method is the one that you are using in case of inversion of uterus. It's a kind of hydrostatic reduction of the inversion. That's known as O'Sullivan method. The signs of placental separation are mainly lengthening of the cord, gush of blood, and the changing of the shape of the uterus. So these are the important signs of placental separation. Lambda sign is what you have seen in twin pregnancy. Buddha sign you will see in hydrops fetalis. Hydrops fetalis means when there is fluid collection within the different compartments of the uterus, like it can be pleural effusion, ascites, or some cardiac overload. This is all happening together, 2-3 compartments when there is too much of fluid overload. This shows sign called Buddha sign. Robert's sign is one that you are seeing in IUD. That's a gas shadow in the gate chambers, but it's an uncommon finding. And the most common finding in IUD, what you are seeing is the Spalding sign. That's an overlapping of the cranial bones. Very, very important, Spalding sign. And the snowstorm pattern you will see in hydatidiform more in case of when you are doing an ultrasound. So that's all about the quick review of a certain important points, and we will be continuing again soon. Thank you so much. Study well.